Today we will start with the adrenergic receptor, adrenergic pharmacology, studying the receptors, agonists, and all the related subjects. The adrenergic drugs are drugs that affect receptors are stimulated by norepinephrine or noradrenaline or epinephrine adrenaline. These receptors are known as adrenergic receptors or adrenoceptors. Adrenergic drugs that activate adrenergic receptors are termed sympathomimetics, and drugs that block the activation of the adrenergic receptors are termed as sympatholytic sympatholytics. Some sympathomimetic directly acting adrenergic receptors directly acting agonist on the receptors and give its effect on the effector, while others act indirectly by enhancing release or blocking reuptake of norepinephrine. Indirect acting agonists, we will come to take it and explain it. Catecholamines are compounds containing a catechol moiety composed of a benzene ring with two adjacent hydroxyl groups and an amine side chain. Pharmacologically, the most important ones are: number one, norepinephrine, a transmitter released by sympathetic nerve terminals; adrenaline, as we mentioned, secreted by adrenal medulla. Dopamine is a metabolite or metabolic precursor of noradrenaline and adrenaline, also a transmitter or neurotransmitter where in the central nervous system. Isoproteinol or isoprenaline, a synthetic derivative of noradrenaline, not present in the body. It is a synthetic one. So let's come to the adrenergic neurons. What is the activities that will take place in the this adrenergic neuron? Release norepinephrine as the primary neurotransmitters. These neurons are found in the central nervous system and also in the sympathetic nervous system, where they serve as the link between ganglia and the effector. The effector organs. Adrenergic drugs act on the adrenergic receptors located either presynaptically on the neurons or postsynaptically on the effector organs. A neurotransmission at adrenergic neurons, how it will take place. Please, when we explain, refer to the presentation or the figures that is shown in the lecture. Neurotransmission at adrenergic neurons. Neurotransmission in adrenergic neurons closely resemble the described for the cholinergic, except that is cholinergic now, or acetylcholine. Now it's norepinephrine. Let's come to it is the same synthesis, storage, release, and receptor binding of norepinephrine, followed by the removal of the neurotransmitter from the synaptic gap, as shown in figure 2. You can show it in the figure 2. Let's come to the synthesis. Tyrosine is transported by a carrier into the adrenergic neurons, where it is hydroxylated to dihydroxyphenylalanine dopa. This is by tyrosine hydroxylase. This is the rate limiting step in the formation of the norepinephrine. Dopa is then decarboxylated by the enzyme aromatic 1 amino acid decarboxylase to form dopamine, is in the presynaptic neuron, as in figure 1 above. Now the storage dopamine is then transported into the synaptic vesicles by an amine transporter system. This carrier system is blocked by reserpine. So dopamine is next hydroxylated to form norepinephrine by the enzyme dopamine beta hydroxylase. In this step, dopamine, when transported into synaptic vesicles by amine transporter system, this carrier can be blocked by reserpine. So sometimes when we need dopamine, we use reserpine to increase the level of dopamine. Otherwise, dopamine hydroxylated to form norepinephrine. Release of norepinephrine and action potential when arriving the nerve, the adrenergic neurons or nerves junction trigger an influx of calcium ion from the extracellular fluid into the cytoplasm of a neuron. This increase the calcium causes synaptic vesicle to fuse into the cell membrane and to undergo exocytosis to expel their content, which is the norepinephrine, into the synapse. Drugs such as guanethidine block this release. So when we want to block the release of norepinephrine, we use guanethidine. Please look at this figure, how it shows the production, storage, release, and the activity or the action of the norepinephrine. Let's come to the binding to the receptor. Norepinephrine released from the synaptic vesicle diffuse into the synaptic space and binding to the postsynaptic receptor on the effector organ or to the presynaptic receptor on the nerve ending. We will come to discuss it very well, how it comes either to. Now it's already come to the postsynaptic receptor of the effector or the next nerve, or by binding to the presynaptic receptor. Binding the norepinephrine to the receptor trigger a cascade of events within the cell, resulting in the formation of intracellular second messengers that act as a link transducers in the communication between the neurotransmitter and the action generated within the effector cell. Adrenergic receptor use both the cyclic adenosine monophosphate, cyclic AMP, second messenger system, and the phosphatidyl inositol cycle to transduce the signal into an effect. So use these two type of second messengers to make the effect. Norepinephrine also bind to presynaptic receptor. The presynaptic, it is mainly alpha 2 subtype, we will come to discuss it, to modulate the release of neurotransmitter, which is the norepinephrine. Removal of norepinephrine may, number one, diffuse out of the synaptic space and enter the systemic circulation to do its effect abroad to other organs. Number two, be metabolized by an enzyme to be inactivated as a metabolite by what? By catechol O-methyltransferase, which named the term COMT in the synaptic space. Number three, undergo reuptake back into the neuron. The reuptake by the neuronal membrane involve a sodium chloride dependent norepinephrine transporter net that can be inhibited by tricyclic antidepressant such as imipramine, or by serotonin norepinephrine reuptake inhibitor such as duloxetine, or by cocaine like in figure 2. Reuptake of norepinephrine into the presynaptic neuron is the primary mechanism for the termination of its effect. So these three types of mechanisms can end the effect of norepinephrine. Potential fates of receptor of recaptured norepinephrine. Once norepinephrine re-enter the adrenergic neuron, it may be taken up into synaptic vesicles via the amine transporter system and be sequestered for the release by another action potential. It is used again by another action potential, or it may persist in a protected pool in the cytoplasm. Alternatively, norepinephrine can be oxidized by monoamino oxidase present in the neuronal mitochondria. Adrenergic receptors, which is very important. Please keep your attention how we will discuss it. In the synaptic nervous system, several classes of adrenoceptors can be distinguished pharmacologically. Two main families of receptor. These are alpha and beta adrenoceptors, are classified on the basis of their responses to the adrenergic agonist, which is epinephrine, norepinephrine, and isoproterenol. Let's come to the first alpha adrenoceptors. The alpha adrenoceptors show weak response to the synthetic isoproterenol, which is the agonist, but they are responsive to the naturally occurring catecholamine, epinephrine, and norepinephrine, as in figure 3. You can see that the schedule: epinephrine more or equal to the norepinephrine, and these two are higher effect more than isoproterenol at the alpha adrenoceptors, which is also the alpha adrenoceptors subdivided into alpha 1 and alpha 2. Alpha 1 receptor, these receptors are present on the postsynaptic membrane. Very important, please keep attention on this, on the effector organs, and mediate many classic effect originally designated as alpha adrenergic involves constriction, one of them, of smooth muscle. Activation of alpha-1 receptors initiates a series of reactions through the G protein activation of phospholipase C, ultimately resulting in the generation of second messenger inositol 1,4,5 triphosphate and diacylglycerol. These are two secondary messengers that mediate the effect of the activation of alpha-1 receptor. Inositol phosphate 3 initiate the release of calcium from the endoplasmic reticulum into the cytosol, and diacylglycerol turns on other proteins within the cell as shown in figure 3. Alpha 2 receptor Alpha-2 receptors. These receptors are located primarily on sympathetic presynaptic nerve ending and control the release of norepinephrine. When a synaptic adrenergic nerve is stimulated, a portion of the released norepinephrine circles back and react with alpha-2 receptors on the presynaptic membrane, as in figure 2. Stimulation of alpha-2 receptors causes feedback inhibition, and inhibition further release of norepinephrine from the stimulated adrenergic neuron. This inhibitory actions serve as a local mechanism for modulating norepinephrine output when there is high sympathetic activity. Note: in this instance, by inhibiting further output of norepinephrine from the adrenergic neurons, these receptors are acting as inhibitory autoreceptors. Alpha-2 receptors are also found on presynaptic parasympathetic neurons in contrast to alpha-1 receptors. So it is very important. The effect of binding at alpha-2 receptors are mediated by inhibition of adenylyl cyclase and by a fall in the level of intracellular cyclic AMP, the second messenger, and blocking the effect of the effector at the effector. Further subdivision: alpha-1, alpha-2 receptors are further divided into alpha-1A, alpha-1B, alpha-1C, and alpha-1D. Add into alpha-2A, alpha-2B, and alpha-2C. This extended classification is necessary for the understanding the selectivity of some drugs. For example, tamsulosin is a selective alpha-1A antagonist that is used to treat benign prostatic hyperplasia. The drug has fewer cardiovascular side effects because it targets alpha-1A subtype receptor found primarily in the urinary tract and prostate gland, and does not affect the alpha-1B subtype found on the blood vessels. Now let's come to the beta adrenoreceptors or adrenoceptors, the same. Responses of beta receptor differ from those of alpha receptors and are characterized by strong response to isoproterenol with less sensitivity to epinephrine and norepinephrine, like in figure 3. Please refer to the figure 3. For beta receptors, the rank order of potency isoproterenol bigger than epinephrine, and this is also bigger than norepinephrine. The beta adrenoreceptors can be subdivided into 3 major subtypes: beta 1, beta 2, and beta 3, based on their affinity for adrenergic agonists and antagonists. Beta 1 receptor have approximately equal affinity to epinephrine and norepinephrine, where beta 2 receptors have higher affinity to epinephrine. For epinephrine than for epinephrine, okay, at beta 2. Thus, tissue with predominant of beta 2 receptors, such as the vasculature of skeletal muscle, are particularly responsive to the effect of circulating epinephrine released from adrenal medulla, as mentioned. Beta 3 receptors are involved in the lipolysis and also have effects on the detrusor muscle of the bladder. Binding of a neurotransmitter at any of 3 types of beta receptor result in activation of adenylyl cyclase and increase concentration of cyclic AMP within the cell, as mentioned in the above. Distribution of the receptor adrenergically innervated organs and tissues usually have predominant type for receptors. For example, tissues such as the vasculature of skeletal muscles have both alpha 1 and beta 2 receptor, but the beta 2 receptors predominant. Okay, other tissues may have one type of receptors almost exclusively. For example, the heart contains predominantly beta 1 receptor. Desensitization of receptors, it depends on 3 mechanisms. Prolonged exposure to catecholamine produce responsiveness of these reduce the responsiveness of these receptors, a phenomenon known as desensitization. 3 mechanisms have been suggested to explain this phenomenon. Number 1, sequestration of the receptor so that they are unavailable for interaction with the ligand. Number 2, down regulation, that is a disappearance of the receptor either by destruction or by decreased synthesis. Number 3, an inability to couple the G protein because the receptor have been phosphorylated on the cytoplasmic sites. This figure that is in front of you shows some activities of the catecholamines on the different organs. Thank you and best regard.